It was a regular sunny day. There was a handsome boy whose name is Zh.Aikyn, and a beautiful girl named D.Arailym. They loved each other and had a good relationship. But in one day, they wanted to try something more. One week later.
Hello, I feel myself bad. My stomach hurts. I have nausea.
Probably you're pregnant.
Hi, I must tell you something. Doctor said I'm pregnant.
How? But we are only 15 years old.
Stop. Let us tell you something.
Early sexual activity is a bad idea. Early sexual activity in teens can lead to unplanned pregnancies, especially when sex education and access to contraception are limited. This can impact physical health, education, and emotional well-being. The essence of the problem is that early sexual activity without proper education or contraception often leads to unplanned teenage pregnancies, or can cause serious health risks like premature births, low birth weight, pregnancy-related anemia, and even maternal deaths. Their bones, especially the pelvis, may not be fully developed, which raises the chance of obstructed labor and the need for risky surgical delivery. Teen mothers are also more likely to drop out of school, limiting their career opportunities. Emotionally, they may face depression, anxiety, and social isolation. Because adolescent girls' bodies and minds are still developing, teen mothers are more likely to experience high level of stress and anxiety and depression. This is due to hormonal change, fear of social judgment, and pressure to take on adult responsibilities at a young age. Many also suffer from lack of support from family, peers, or partners. These challenges can lead to lifelong poverty and negatively affect both the teen and their child's future. According to statistics, every year about 21 million girls aged 15-19 in developing regions become pregnant, and 12 million give birth. Globally, the adolescent birth rate dropped from 64.5 per 1,000 in 2000 to 41.3 per 1,000 in 2023. Also, according to the statistics by region, Niger has the highest teenage pregnancy rate at 203.6 per 1,000 girls, driven by poverty, lack of sex education, early marriage, and low parental guidance. Mali follows with 175.4 per 100 girls. The remaining girls are married and give birth before 19. Then Angola ranks third with 166.6 per 1,000 girls. Only 15.5% of girls reach secondary school, and lack of education, poor access to healthcare, and early marriage contribute to high pregnancy. It shows that the highest teenage pregnancy is relevant in areas that have lack of education and financial support.
There are three solutions for this problem. First is comprehensive sexual education in schools, provides accurate information about reproductive health, contraception, consent, and healthy relationships. Helps teenagers make informed decisions and reduce risky behavior. Second is improved access to contraceptives and reproductive health services. Ensures teens can easily access birth control, emergency contraception, and confidential counseling. Helps prevent unplanned pregnancies, especially in areas with limited healthcare. Third is parental and community involvement. Involving parents and the community helps prevent teen pregnancy by promoting open communication, values, and guidance. Teens who talk with trusted adults are more likely to delay sex and use protection. Community programs and role models are also support healthy decision making, and reduce peer pressure. What has to happen for pregnancy to occur after sexual intercourse? Sperms swim up the vagina through cervical opening, upwards through the uterus and into one of the two fallopian tubes. If an egg released during that month of ovulation is in the tube on one sperm has a chance to fertilize it. Contraceptives are designed to prevent this process, and they work in three basic ways. They block the sperm, disable sperm before they reach the uterus, or suppress ovulation. Block is the simplest. Male and female condoms prevent sperm from coming into contact with the vagina space. That barrier is also why they, unlike other contraceptive methods, are able to prevent transmission of certain sexually transmitted diseases. Second category, disable. A spermicide is a chemical that immobilizes and destroys sperm. A semicircle that is a chemical that immobilizes and destroys sperm. Spermicides come as foam, cream, jelly, suppositories, and even a thin piece of translucent film that dissolves in the vagina. Third category works by suppressing the action of an egg maturing in the ovary. If there isn't an egg available in the fallopian tube, there is nothing to sperm to fertilize. Hormonal contraceptives, including the pill, the patch, the depot shot, and the vaginal ring, all release synthetic versions of various combinations of progesterone and estrogen. This hormone cocktail suppresses ovulation, keeping the immature egg safely sequestered in the ovary. This solution works by preventing fertilization or ovulation, which stops unplanned pregnancies before they can occur. As a result, teenagers are able to take control of their reproductive health and make informed choices. With fewer unplanned pregnancies, the risk of childbirth complications in young girls decreases significantly. Additionally, girls are more likely to stay in school and complete their education, improving their future opportunities and overall well-being.
According to social factor, teenage pregnancy has a strong impact on society because it affects education, relationship, and future opportunities. Our solution have such advantages. It reduces teenage pregnancy rates, allowing girls to stay in school and socialize with peers without interruption. Second is encourages open conversations between teens, parents, and educators about sexual health. Third, it helps reduce social pressure on teenage mothers who often face judgment and limited life opportunities. Disadvantages of our solution, of our contraception solution, is that in some cultures, using contraception as a teenager may be seen as promoting immoral behavior, leading to social criticism. Second is accessing contraception can be socially difficult due to embarrassment or fear of being judged by peers or adults. Contraceptives are not always affordable or accessible, especially in low-income or rural areas. The last disadvantages is that they are side effects which almost exclusively affect women rather than men. Hormonal methods in particular can cause symptoms like headaches, nausea, and high blood pressure, but they vary from woman to woman. That's why they require a prescription from a doctor.
In conclusion, we can say that teenage pregnancy is a serious issue that affects health, education, well-being, and future opportunities. Among the possible solutions, access to contraception and protection is the most effective and science-based method to prevent unplanned pregnancies. It gives teens control over their reproductive choices and helps reduce health risks. However, social challenges such as stigma, limited access, cost, and side effects, especially for girls, must be addressed. A balanced approach combining education, healthcare access, and community support is a key to reducing teenage pregnancy and its negative consequences.